Hi everyone, welcome to my presentation on palliative care and pain management. My name is Ben Kane, and before we go any further, let's get into it. So what is palliative care? Palliative care, according to our textbook, the Handbook of Health Social Work, palliative care is meant to improve the quality of life for patients who are facing life-threatening illness through means of prevention and relief of suffering. This is pretty widespread. There's a lot of different things that go into it. It can be achieved through treatment of pain, which is not just like physical pain, but also psychosocial and spiritual distress that is caused by these types of life-threatening illnesses. Usually, we're talking like cancer, things that are, generally pretty terminal. And then these treatment plans are developed based on the results of assessments. Pain management care uses a lot of similar treatment, generally because they are chronic conditions that stem from life-limiting illnesses. So these are some of the ones I listed here are migraines, arthritis, and fibromyalgia and similar types of things like that. So it's again the goal there is to prevent and relieve suffering as much as possible. Differences from other medical populations. Probably the largest difference is that generally rehabilitation isn't the goal with with this treatment, but instead the focus is providing the individual dignity during their end of life process. This from the article that I had from last week, which dealt with palliative care in a corrections setting. The goal is to provide the individual with a good death. So, what is a good death? A good death is generally based on what the individual feels is a good death. So, this is where you are going to be communicating with them, asking them what this means to them, what needs to be done in order to give them the good death that they are seeking. Qualities of a good death include, but are not limited to, comfort, familial relationship status, seeking closure, and adequate social support. These were some of the ones that were suggested in the discussion post from week 5. There's a bunch of other ones that, again, since it's, everyone is going to have a different good death, there are going to be a lot of different qualities that make up a good death, and some matter to some won't matter at all to others. This is based on the ideal that the end of life is part of life process and therefore should be treated like any other part of our life process, in that we should be treated with dignity. Some of the major challenges that pop up in palliative care and pain management are due to the chronic pain and the psychosocial and spiritual distress that is associated with life-threatening and limiting illness. A major challenge for palliative care is helping the individual complete the mundane tasks and treatments despite feelings of hopelessness and loss of dignity. Um, the mental health aspect of palliative care is very crucial. These people are dealing with very, very chronic pain and constant stress, and you know, we all know, those things can definitely continue to lead to a very bad state of mental health. This is common during the end of life processes and is amplified due to the pain associated with the illnesses. Another major challenge is helping the individual achieve a good death. This is, pretty hard to do. Um, it can mean a variety of factors depending on the person's culture, beliefs, and whatever other components of that person's life come into play. We need to be respecting all of those in order to give them the good death that they and we are seeking to provide them. This challenge can be combated through communicating with the individual, but it requires the caregiver to have an open mind and to accept that the individual's choices might be different from what you're used to or what you think is appropriate. But at the end all result is that we want them to be able to uphold their dignity through their dying process. So how are we going to solve these issues? There are a very wide variety of interventions, which we should all be used to, that could be used to help resolve these challenges. Supportive counseling helps manage the stress levels of the individual and their family members, while also helping with easing the decision-making process. Um, Monitoring and communicating with the individual to ensure that they understand their situation are common practices of many of these interventions, some of which are cognitive behavioral therapy, CBT, cognitive reconstructing, and several others. The intervention used should be one that is most appropriate to that individual, and each case should be treated uniquely because every person is different. We need to treat each person as if they're their own person. Um, so we'll get a little more specific into the major challenges we brought up, or that I brought up earlier. Interventions are helpful and would definitely be utilized when working with this population to address the challenges with individual psychosocial and spiritual needs. Partializing seemed like a tool that would be really effective. Partializing is a process where problems are broken down to make them less overwhelming to the individual. This is definitely a practice that could be utilized to break down, the kind of the whole feelings of the end of life process and kind of gain the perspective of the individual while also trying to help them to make peace with their situation. As mentioned above, communication, open-mindedness, and active listening are all going to be necessary for resolving the challenge of giving the individual a good death. It also would be helpful in managing their mental health as well. These are broad approaches, again, that should be narrowed down and specified to the individual in an actual palliative care setting. This is kind of more just theory. Social worker resources. So this is just a quick list of resources a social worker would probably need in this that would be beneficial to help them support individuals in this care setting. Social worker would need an understanding of the various interventions and how to best apply them. The National Social Work Code of Ethics would definitely be useful. Open-minded manner of thinking, understanding of treatments and assessments, knowledge of the government and community resources available to the individual, access to mental health care and self-care to help deal with the emotional distress that is associated with this area of the field. Because when you're dealing with people that are dying a lot, it's generally going to be kind of difficult on your mental health. Everyone's different, but that is something that would be very helpful to a social worker in this setting. Patient resources. So these are a list of things that the patient would probably need that would be beneficial to them. Quality health care, including access to specialists that may have a little bit more expertise in their specific ailments. Access to financial resources for individuals that are unable to work due to their illness, whether that's government-based, community-based, however. A social support system, so that's family, friends, support staff, depending on whatever that person's life is, getting the people in their life to be able to be around them. Access to medication that will ease their suffering and help managing their mental health, access to mental health treatment, and understanding their limitations that are caused by the illness. The social worker role for this is while healthcare staff will be more part of the day-to-day management of pain and any needed medical attention, the social worker is also involved in the management of the mental health, whether that is providing mental health care themselves or assisting with finding another mental health professional to work with them. The social worker's role during palliative care is to help the individual understand their situation and make peace with their end-of-life process, help them access any resources that may be beneficial, advocating for the individual in necessary circumstances, and to help with providing them a dignified end-of-life and good death. The social worker may also be asked to work with the individual's family to help them with their process on that end as well. These are the two main references that I used. Thank you guys for listening. Hope you learned something, and see you around.